In Mongbwalu, in the Eastern Democratic Republic of the Congo, efforts are being organized to fight Ebola.
If you don't protect yourself or wash your hands, you'll be at risk.
These volunteers walk the streets of this mining town of 200,000 residents to raise awareness among the population. Because here, the virus, transmitted through physical contact, is spreading rapidly.
If we don't protect ourselves, there's a good chance this disease will continue. But if we take preventive measures, we'll be able to limit its spread.
Awareness campaigns are carried out under heavy security. These volunteers have already been attacked. They were wrongly accused by residents of spreading the disease. It was in this working-class neighborhood of Mongbwalu that the first cases were registered. Paul Kayongo is the neighborhood pastor. In February, he started witnessing a series of suspicious deaths.
This household was the first to be affected. The man who died here was my uncle, along with his wife, their child, and his wife's older sister.
At that time, no one yet knew that Ebola was spreading in the area. Saying goodbye to their loved ones, the residents touched the bodies, which were highly contagious. Very quickly, the epidemic began to spread. Deaths were mounting.
Over there, up here, there were many deaths in the Shuni 1 neighborhood before anyone knew it was Ebola. Some families lost 6, 8, 10 members.
Yet nearly 3 months passed between those first casualties and the official declaration of the outbreak on May 15th. The authorities insist that an investigation is underway to explain this delay. The neighborhood now lives in fear. Entire families have fled to avoid being infected.
Many people have left the Mongbwalu neighborhood. I'm afraid, but I've stayed here because I've nowhere else to go.
In an effort to contain the outbreak, NGOs have set up an Ebola treatment center at the Mongbwalu hospital. Behind these barriers, patients are placed in isolation. For this strain of the virus, there is neither a treatment nor a vaccine. Care is palliative. Most arrive with symptoms that are already advanced, a delay that reduces their chances of survival. Deaths are occurring one after another. Inside these bags lie the bodies of victims. A few hundred meters away, a family has just lost a child. From Mongbwalu, the epidemic has now spread across the region, reaching Bunia, the capital of Ituri province. Here, too, several emergency Ebola treatment centers have been set up. In the eastern part of the country, 9 centers are treating nearly 500 patients. Dr. Richard is in the middle of a consultation. This patient is on a ventilator and receiving strong pain medication. His condition is critical. His chances of survival are very slim.
The patients are in pain all over. They need systematic pain relief, just as a trauma patient would. When they arrive very late with a high viral load and already with multiple organ functions compromised, more than 2, it becomes complicated.
To rebuild trust and encourage patients to come in as soon as the first symptoms appear, this center has set up glass isolation rooms. Thanks to these transparent walls, patients remain visible to their loved ones. Visits can take place without the risk of infection, a strategy that seems to be paying off. More and more patients are coming in as soon as their first symptoms appear, and recoveries are on the rise.
You see, we just walked through 2 rooms, and they're full, but these patients are going to walk out the door. They've been through the whole process, they were unstable, but now the storm has passed. And when they start leaving like this, 3 or 4 at a time, it really lifts our spirits.
These recovered patients represent a glimmer of hope in a province hit hard by the epidemic. In eastern Congo, the battle against Ebola is far from over. More than 250 people who tested positive for the virus have already died, a death toll that humanitarian organizations say is largely underestimated. Some areas remain completely inaccessible due to insecurity.